something that has been produced by an organ from cells in our body. They go into the bloodstream and they tell other cells how to work. We know about lots of hormones, of course we do, hormones such as insulin and thyroxine. But when we talk about estradiol, progesterone, testosterone, everyone seems to get confused and panic and worried. So I just thought I'd spend a bit of time talking a bit more about what these hormones are, what they do, and why they're different to some of the hormones that we take in HRT, because that's caused the biggest confusion really. Many of you might know that I'm a physician, but I'm also a scientist, so I have a degree in pathology, the study of disease. I'm very interested in molecular biology. I'm very interested in how our cells work at a very if you like, granular level. I want to know what's going on in the cells. I want to know what's going on in our genes. I want to know what's going on in the nucleus of our cells. Because once we understand how our cells work, it's then easier to understand how our tissues work and how our organs work as well. So over the last decade or so, I've spent a lot of time really trying to understand how these hormones work in our body. I'm making up for borrowed time, if you like, because when I was a medical student, I wasn't taught about estradiol, progesterone, testosterone. I was taught how to prescribe the contraceptive pill for women to stop them getting pregnant. I was taught about the menstrual cycle and how our hormone levels change. But I wasn't taught about how these hormones work in our tissues and our organs, especially in our brain. So I've spent a lot of time and effort and energy reading papers, reading academic texts, reading history books as well, to try and understand about our hormones. Because I think as women, as patients, but also as physicians and clinicians, we should be really clear what we're talking about. Our use of language is really important when it comes to hormones. And we should be understanding what these hormones do in our body. One of the biggest problems with history is that when hormones were discovered, there was a race to make them synthetic. There was a race to get them to market. And the people that the scientists worked with right from the start were gynecologists, because they were looking at the effects of hormones from the ovaries and the effect on the womb. It took quite a few years for people to realise the importance of the effects of hormones elsewhere in our bodies. And it took a few decades for people to realise they weren't just hormones that were produced by the ovaries, they were produced in other organs as well. When we talk about estrogen, we have to be really clear what we're talking about as well, because there are different types of estrogen. So when we talk about estrogen, even natural estrogen that we make in our body, we have three main types. We have estradiol, which is the type that we most make when we're younger. And it's the most beneficial type of estrogen. It's very anti-inflammatory. It's very good for all our body and our systems to work. We also have estrone, which is a very weak type of estrogen. And actually, when our bodies, especially our ovaries, stop making estradiol, then we produce more estrone. And estrone is made from our fat cells as well. So if our body isn't getting enough estradiol, it tends to make more adipocytes, more fat cells, so we can then produce more estrone. We need to make even more of it than we would estradiol because it's so weak in our bodies. And it doesn't have the same effects. It's not just slightly weaker, it has different effects than estradiol, and it can be quite inflammatory on the body, so increase inflammation. And as I'm sure you know, for our future health, we want to reduce inflammation. We want to have low levels of inflammation in our body so we can keep healthy for as long as possible and reduce the risk of diseases. The other type of estrogen is estriol. Again, we produce a very small amounts of it other than when we're pregnant. And when we're pregnant, we produce higher levels of estriol. It's thought to be beneficial, but we don't know the full effects of having higher levels of estriol in our bodies when we're not pregnant. So three types of estrogen. When I talk about estrogen, I'm really trying to be more and more clear on my website, podcasts and so forth, to talk about estradiol, because that's the best form of estrogen, the form that we need actually, and the form that our body and cells work best with, but it's the form that we don't have as much of as we become older and our ovaries don't work as well. So during menopause, our estradiol levels are low, and once they're low, they stay low forever. So this whole myth of people being through the menopause is actually causing a lot of confusion, because menopause is literally, as you know, a day when our periods have stopped for a year. But actually we need to be thinking beyond that. We need to be thinking about the hormonal changes. And once estradiol levels are low, they are always low. And this is having some biologically negative and detrimental effects on our bodies. So estradiol, the most important form of estrogen. Then progesterone is a really important and under-recognised hormone. You might have heard me talking about progesterone. I spent my YouTube live last week talking to Dr Hannah Ward about progesterone, and I've talked about it on other YouTubes as well. And our progesterone is formed in many areas of our body. Obviously our ovaries produce it, but so does our brain as well, and it has effects on every single cell in our body. It has different effects to estradiol. And then the other hormone that we need to think a lot about is testosterone. It's just such a shame it's called testosterone, derived from testis. And of course, male testes make testosterone, but so do female ovaries, and also our brain makes testosterone as well. And testosterone is the most biologically active hormone that we have in our body. It affects every cell in our body. Now, some of you might have seen we've produced these posters, and if you go onto my website, drlouisenewson.co.uk, that's drlouisenewson.co.uk, and in the search, actually, if you just put posters, it will come up and you can download them and do what I did and just print them off. They're very, very simplistic, but they're just enabling people, hopefully, to think about the role of these hormones beyond the ovaries. They are not just needed for reproduction, they are needed for health, for biological processes to occur. So I've just done a simple picture of a woman, and then we've got different areas of the body, so the brain, the heart, the skin, and so forth, and it's just showing different effects. So if I read some of this, which you can obviously download yourself, but it talks about how estradiol improves the blood flow in the brain. It improves mood, reduces anxiety, it helps with learning, it helps with body temperature control, it improves memory and focus, it increases levels of other neurotransmitters in the body such as dopamine, serotonin, acetylcholine, noradrenaline, melatonin. It improves sleep. It increases connections between the brain cells, this is in the synapses, and improves energy. So just thinking about the effects in the brain, the way that this is the natural estradiol that we produce when we're younger has on our brain, then it's quite easy to think about, so what happens when we don't have that hormone? When we're menopausal and our levels of estradiol are low, what are the effects on the brain? Well, of course, if it increases levels of dopamine and serotonin in our brain, it goes without saying really that if levels of estradiol are low, then we have low serotonin, we have low dopamine in our brain, and no wonder many of us become very low and flat and joyless and depressed when we're perimenopausal or menopausal. And the same with other organs. So with our heart, it controls heart rate. It keeps the lining of the arteries, the endothelium, very healthy. It helps lower blood pressure. So again, if you don't have estradiol, guess what? Your blood pressure is going to go up when you're menopausal. You'll more likely have palpitations. You'll more likely have the thickening and furring of the artery, so atheroma, because you don't have these anti-inflammatory effects on the endothelium of that estradiol can have. In the liver, it helps our cholesterol regulation because cholesterol is made in our liver. So guess what? If you don't have estradiol, when you're menopausal, you'll more likely have raised cholesterol. And it helps the glucose metabolism, helps break down of fat and improves our liver function. So if we don't have estradiol, our liver doesn't work as well. We have an increased incidence of non-alcoholic fatty liver disease, for example. We have less good glucose metabolism, so we have a greater risk of type 2 diabetes and metabolic syndrome. So this is what I was saying at the beginning. If you understand how the hormones work in the body, then it's so much easier to understand what's going wrong when we're menopausal and we don't have good levels of estradiol and the other hormones as well. In our skin, it helps with collagen production, reduces moisture loss, increases blood supply to the skin. No wonder so many people have dry, itchy skin and find that they have more wrinkles, they have less collagen in their skin. So rather than just thinking about, do I take collagen supplements or not, then thinking about, well, if I have estradiol back, then it's going to help the skin as well. And that's not just a cosmetic thing, actually, because as I've said before, if our skin is healthy, our internal organs are more likely to be healthy. And next week, I've got Raj Sajpal. We're going to do a whole session on skin and hair for you. If you think about bones, really, really important, because 1 in 2 women who are menopausal will develop osteoporosis. Our bone loss starts to accelerate when we are perimenopausal. About 16% of our bone density is lost when we're perimenopausal, when our hormone levels reduce. So in our bones, we have increased, with estradiol, we have increased bone mineral density, reduces inflammation in our joints, increases muscle strength, improves flexibility, lubricates joints. So no wonder when I was perimenopausal, doing yoga was really hard. I felt like the Tin Man. My joints felt very stiff. I had a lot of muscle aches. I wasn't so flexible. I couldn't touch my toes as easily as I can do normally. And a lot of pain in my joints. Really not just a stiffness, it was pain as well. No wonder when we know how estradiol works. And we also know when we don't have any estradiol, we have even more bone loss, even greater risk of osteoporosis. We know in our bowel it helps maintain the function. It also maintains the balance of the friendly bacteria and reduces heartburn. So again, a lot of women are diagnosed with irritable bowel syndrome, heartburn when they're menopausal. But rather than giving medication for irritable bowel or giving PPIs like omeprazole for the heartburn, how about thinking about the underlying cause more? There's lots of effects on the nerves. We know it improves the nerve transmission. It helps build myelin, which helps, it's like the conduction part of the nerves, if you like. So again, if we don't have estradiol, our nerve impulses are not so quick. So we become less, we can't think as clearly, we have less coordination, we often have less muscle strength as well. And our bladder, it can help reduce risk of infection and improve bladder function. So again, when our estradiol levels are low, we have an increased risk of urinary tract infections, cystitis, pelvic floor dysfunction, incontinence. The list goes on because the hormone is so important. And then finally on here, I talk about the vulva and vagina because it increases lubrication, maintains the balance of friendly bacteria in the vagina and keeps the tissues healthy. So a lot of people have symptoms of vulvovaginal discomfort, soreness, irritation, like I say, recurrent urinary tract infections as well. And then they're the same colour, but they are different. This one is about progesterone, and I've printed on the other side the one about testosterone as well. I'm not going to read them through because you can get them from the website. But again, they have similar functions throughout the body. And these are just very short lists of what these hormones do. Estradiol, for example, is involved in about 400 different processes in the body. And if you look in a very cellular level, we have receptors on the cells, and it's a bit like a key and lock. So if you think of the receptor being like the lock and the hormone being the key, it's really important we have the right shaped key for the right size lock, because once the key goes into the lock and can be unlocked, then there's all these lovely biological reactions that occur to make our cells work well. Every cell has different functions, so cells in our brain are not going to work in the same way as cells in our liver. They have different ways of functioning, but those hormones all work really well for those biological processes to occur. Then they have receptors in the within the cytoplasm in the nucleus as well. And in the nucleus is where all the DNA is formed. So they can help with the way that the DNA works. And DNA is a really important messenger for a whole body, actually. And we know that if our DNA is good and healthy, we have less risk of diseases such as cancer as well. So it's helping to protect us. It's so important that we know that it's the right shape of hormone going into the right lock. because when we think about the different hormones, like I said at the beginning, when people talk about hormones as in HRT or hormones as in contraception, often we're talking about ones that have been man-made, so they're chemically altered. We sometimes call them synthetic, but I've been thinking a lot about this today, and I think calling things natural or synthetic can cause a lot of confusion, because a lot of people are hoodwinked, if you like, from great marketing into taking natural supplements, but actually they're not natural. We don't know what they do in their body. They don't have they don't have an actual a reason in the body or a function in the body, if you like. Whereas when we say synthetic, it's almost like it's been made. The hormones we prescribe, of course, they've been made, but they're not artificial. But the older types of hormones in HRT and contraception are artificial hormones. So they've been chemically altered in the structure. So the key doesn't fit the lock in the same way. And this is really important when we talk about the risks of hormones, because when we talk about risks, everyone gets very scared and think it's all related to HRT. But when we look at the evidence and we look at the biology, of course it's related to the synthetic hormones that are artificial, that have been chemically altered. And that's why we know, and we've known for many years, that there are risks, for example, of taking synthetic progestogens. So progesterone, the natural progesterone, is very different to synthetic progestogens because they've been chemically altered. So in the WHI, the Women's Health Initiative study, the part of the study where there was a small increased risk of breast cancer, it was women that took estrogens with a synthetic progestogen, progesterone acetate. When we look at the risk of clot and heart attack and stroke, it's with synthetic progestogens, and it's also with synthetic estrogens, not with natural hormones. If natural hormones were so dangerous, then women wouldn't be so well when they were younger. Our brains certainly they are very responsive to changing hormone levels, but not just the actual absolute levels, but the change, the sort of chaotic nature of hormones that can occur when we're either having periods or perimenopausal. Even when those hormones are natural, if they're sort of only sometimes putting the key in the lock and other times they're not there, or the levels are changing, it can really disrupt the way that the cells work. But the biggest disruption, of course, is having synthetic hormones. And that's why so many people have side effects and actually risks when they take synthetic, the artificial hormones. So our terminology, our language has to be really, really clear. And that's why it can be very confusing when we're looking at benefits of hormones. If you think for some of the studies, for example, looking at heart disease, some studies have shown that women who take hormones have a much lower risk of heart attacks and heart disease by about 50%. Other studies, it's less clear, but when you look at the evidence in the original papers, it's because they've grouped together women who are taking these synthetic, i.e. artificial hormones, and the natural hormones. And then it's less clear the benefits. Some people talk about this 10-year window of opportunity, so the cardiovascular benefits are only there in women less than 60. I've thought for a while, how does a 61-year-old woman's cardiovascular system differ from a 59-year-old's? Of course it doesn't. We have new cells forming all the time, so cells in our heart system are not going to work differently if we're 61 as opposed to 59. The difference is in the studies that show there was an increased risk of heart attacks and strokes in women over the age of 60 were because they were using synthetic hormones. So often we're extrapolating and using old data to suit people's agenda or to scare women from hormones, rather than thinking about the basic biology and how the hormones work in our body. Having the right balance of hormones is important as well. So often people talk about having this triangle of hormones, the progesterone, estrogen and testosterone, because they work very closely together. So it's not a fact or enough often to just have one or even two hormones. Often it's having all three. But for some women, they respond better to just one. And having individualized treatment is the most important thing, actually, that I feel very strongly we can do as clinicians. Some women, when we give back the natural body identical hormones, respond very well and very quickly. properly. Other women, it can take many months, sometimes years, to get the right dose and balance. And we have to be really patient when we start taking hormones, especially when we start. I see a lot of women in my clinic who have had many months, sometimes many years, with inadequate or suboptimal hormones. A lot of women I see are already taking hormones, but it's not the right dose or type for them. So when I start to change hormones or prescribe them for the first time, I spend quite a lot of time saying to women, you have to be patient, you have to really wait 3 to 4 months after starting hormones before you might notice a benefit. Some people feel worse before they feel better, because it can take a while for all these cell processes to become activated, to work properly again, for that DNA to change, all those processes in the cells to alter, and also the hormones to work properly with other hormones. So like I said at the beginning, if we have estradiol, we have more serotonin, we have more dopamine, we have more glutamate, acetylcholine, and other neurotransmitters. But it also can affect our glucose, our insulin, and even affect our thyroxine. But these hormones have got to learn how to work with estradiol, progesterone and testosterone. So it can take quite a while sometimes for a woman to feel really balanced. And sometimes we need to change the dose as well, or change the formulation. So patience is a real virtue, and it's very difficult because so many people now talk about how they feel wonderful on HRT. But actually, for many of us, even a small change can make a real difference in a positive or a negative way. And obviously, it goes without saying, it's not just thinking about hormones, it's thinking about anything else that's going to help balance and improve our lives and reduce inflammation. So at the same time, or often after thinking about hormones, we need to be thinking really clearly and honestly with ourselves about our nutrition, our exercise, and so forth. But we can't do everything together. We have to be quite patient, and working with someone who's very holistic is really important. I liaise with a lot of people on my social media who tell me that they've had bleeding, they've seen the doctor, they've been told they have to stop their HRT straight away. Well, we don't have to stop straight away. Sometimes if people have side effects, including bleeding, they might need to have some further tests. But the reassuring thing is, even about bleeding, that women who take natural hormones are healthier than women who don't. We know that from many studies. They have less inflammation in their body. Even thinking about cancer of the lining of the womb, they have a lower risk compared to women who don't take any hormones. So we don't need to rush and make changes. When we do make changes, hormones don't last very long in the body. They can come out of the body very, very quickly. And so that's why it's better to change the dose rather than to stop, unless, of course, there's a medical reason to stop taking the hormones. But we need to be thinking about the dosing, the absorption, and the type of hormones that we're taking as well. And if someone is taking a synthetic, so an artificial type of hormone, then we need to be thinking about, is that the right type for them, or should we be changing to a more natural one, because we want to replicate like for like. If I had a deficiency of vitamin D, I wouldn't take vitamin B to replace that deficiency. I would take the vitamin D. If I had if I had low protein and I wanted to eat some chicken, I wouldn't have chicken flavored crisps. I would eat proper chicken. And this is the difference between these synthetic hormones and natural hormones that for many years people haven't understood. And I hate to admit it, but I didn't understand it for many years because no one taught me. I was talked about prescribing hormones for a woman, prescribing hormones and contraception, but they're very different when we think metabolically and biochemically and biologically how they work in our bodies. So I hope that's been useful. I can see there's some questions, so I'm going to put my glasses back on and try and answer them to try and help. So I hope this is useful when you ask questions. Thank you, Dr Louise. My GP took me off estradiol patches and now prescribed me Lenzetto. And then I was bleeding with blood clots. I'm going crazy. The Lenzetto is a spray, and I tend not to prescribe it actually. When it first came out, I thought, great, another way of getting estrogen through the skin, or estradiol through the skin. But in my clinical experience, and we see a lot of patients in our clinic, it just doesn't get reliably absorbed. The thing is also, if something doesn't get reliably absorbed, it causes havoc on the lining of the womb. You can imagine the lining of the womb, like all our cells in our body, like our hormones, to be quite stable. If you're getting unreliable absorption, you can get unreliable amounts in the lining of the womb. And this can trigger bleeding, even quite heavy bleeding as well. So I tend not to prescribe Lenzetto. If the estradiol isn't working, or I know there's a shortage at the moment, then sometimes we change to other patches. In the UK, we often use Everol patches, or we might change to Estrogel or Sandrina, which are types of gel. This is where it can be useful also doing estradiol blood tests. They're only a guide, but it can be useful to see how people are absorbing them. My doctor started me on progesterone for perimenopause. Do I need estrogen as well? It's very individual. Sometimes people lose progesterone before they lose estrogen. And so sometimes we will give progesterone first, assess response, maybe do an estradiol level, but again in perimenopause it can really fluctuate, and then maybe add in estradiol, maybe testosterone as well. It's all about starting the hormones at the right time. A lot of people with PMS and PMDD might be absolutely fine just with some progesterone. Does progesterone cause weight gain? Not usually. Synthetic progestrogens can, because they can sometimes cause fluid retention as well. And also the synthetic estrogens can sometimes as well, because they can get metabolized to estrone and change metabolism too. If you don't have enough of estradiol, then your body will still try and make more estrogen by making estrone from the fat cells as well. My doctor said estradiol can raise blood pressure. I'm bordering high blood pressure. So no, actually that's not right. He's probably, or she's probably thinking about the synthetic estrogen. So in the contraceptives, of course, estrogen can increase blood pressure because it's synthetic. It's not the same chemical structure, so it doesn't have these protective effects on the cardiovascular system. If you listen to my podcast that I did, the first one I did with Dr. Felice Gersh, then we talk a lot about the cardiovascular protective effects of estradiol. And one of them is to dilate the blood vessels to help reduce inflammation on the lining of the blood vessels, and work on the RAS system, the renin-angiotensin system in the kidneys, which actually helps and regulates our blood pressure, and also helps with the sort of salt retention, if you like. So estradiol actually can help reduce blood pressure. The natural progesterone can as well, and so can testosterone, whereas the synthetic hormones have very different effects. I'm on all three hormones, been increasing estrogen with my doctor. They stick on well, some symptoms remain. New symptom came on Thursday. So again, if someone's on patches and they've been on them for a while and they're still having symptoms regardless of the dose, I would often do an estradiol level and see. If the level was low, it suggests suboptimal penetration through the skin, and I might change preparation or increase dose. We increase dose sometimes to get adequate penetration through the skin, and we've known for decades that different women often need different doses. Does perimenopause impact the lymphatic symptom, such as lymph nodes, swelling, various parts of the cycle, fluid retention in the face? Yes, it does. It can really help with, it can really alter inflammation, but also fluid retention. So some people get conditions such as lymphedema, or just feel more bloated at certain times, and it's often related to progesterone as well. Having synthetic progesterone can make it worse, but the natural progesterone, either orally but by pessary, can improve. What is your opinion of red light therapy, PMB for bones and joints? I mean, red light therapy, saunas, they can all be good, but they're not going to replace the missing hormones. That's what you need to remember. The best thing I ever had, taking HRT and testosterone, my life changed completely. Oh, that's good. I recently noticed my heartburn had gone. After years of suffering on and off PPIs, nothing worked. Then with estrogen, it's gone, but it took 1.5 years. Yes, it can take a while. A lot of symptoms can take quite a long time. There are some symptoms like flashes and sweats can improve quite quickly, but other symptoms can take quite a long time to improve. Am I the only person to have a bad reaction to intrarosa? Thought my interior of my vagina was better, than my pelvic was terribly inflamed. So sometimes it's not actually the hormones. So intrarosa contains DHEA, which is a precursor, if you like, to estradiol and testosterone. It's sometimes not the actual hormone, it's what it's made up in. And so if people have a reaction, they can actually have a cream or a pessary which is made in a different way. So somebody in my clinic recently, I got it made up in a coconut oil because it's just calming and not irritating into the vagina. My hair is falling out, and my blood test came back normal. Could it be due to the HRT? Depends on the dose and type. Synthetic hormones can cause some hair loss. Lots of people think testosterone causes hair loss, but it can actually help with hair growth actually. But I'll be talking about skin and hair next week with Sag. Is there a risk if you take progesterone continuously? No, not really. Some people talk about having a break from progesterone and resetting the receptors. For some women that's beneficial, for some women it isn't. It's again all about individualization. PPIs reduce stomach acid, which worsens the whole digestive process. Best to take digestive enzyme. Yeah, I mean, and looking at eat very few factory made foods. Of course, we should be eating healthily and not having inflammatory diets, not having processed foods. Of course, that can make a difference. Eudigesta 100, can this be this tablet used as a pessary? Off license, it can be used as a pessary. Sometimes we prefer giving cyclogest because it's actually made as a pessary, whereas Eutrogestan is a gel-filled capsule. So sometimes people find it's a bit messy or they doesn't get absorbed very well. Some people actually find having it rectally is even better than vaginally. So if you find, somebody asked me on my Instagram about it earlier, if you find that having it vaginally or orally you're getting side effects or intolerant or you don't like it, it might be worth trying it rectally. The dose of cyclogest can be 200 or 400 and obviously it can be cut so people can start with a lower dose. Sometimes people need 400 2, 3, 4 times a day, but listen to my YouTube live with Hannah Ward that we did last week to learn more. 45, going through perimenopause, missed period last month. I'm taking Progesterone and Eutrogestan 12 days a month. Should I continue taking it if I miss more periods? Yeah, I mean, usually we say take it for 12 or 14 days every month. So usually it's 2 weeks on, 2 weeks off. But after about 6 months or so, you can take it every day, especially if periods become more scanty. Then it's less likely that you'll get breakthrough bleeding when you take one each evening. I'm on the Femring because that's the one with less side effects to me. What do you know about it? So the Femring contains a synthetic type of progestogen with it. We don't use it in the UK, but I know it's used in the US more. And you can have it with testosterone. Testosterone can improve mood and you've also said muscle weakness as well, which it can improve as well. Can you tell if dual patches work as well as separate patches and progesterone pill? The combination patches contain the natural estrogen, estradiol, but they contain a synthetic type of progesterone. Some people find they work well, but they are still a synthetic progesterone. I don't prescribe them first line. I usually try and prescribe the natural estradiol with the natural progesterone. Every time I go to my GP about PMDD and ADHD worsening before my periods, they blame my eating disorder for irregular periods and never escalate further. How do I educate on this? Maybe show them that nice graph of just how our hormones change throughout our cycle and remind them that our hormones really have an effect on our brain as well. I did a YouTube live with Judith Morling, a doctor who's a psychiatrist, this week, which is on my YouTubes. It's worth listening to. And really, I find it very hard when doctors are blaming people or trying to make them think about other conditions. In medicine, we have to think about the most obvious thing. And I would really ask about having natural hormones back. And it might be that you need 1 or 3 hormones. But ask about what are the risks of me trying those hormones and just seeing for myself if I improve in my symptoms. Or you might have to come to a clinic like ours to get some individualized advice and treatment, and then often GPs take over prescribing. I used Everall, but I bled after 2 months. My doctor stopped but never gave me anything else. I'm 61, just started testosterone. Often taking estradiol and progesterone is beneficial as well, so it would be worth speaking to your doctor about it. What about if you're using pessaries and you have periods? Well, if you're using the progesterone pessaries, you can use them rectally, so you can put them as a suppository in your bottom. So cyclogest can work very well. So if you're having periods, it doesn't matter. How do you prevent contamination if you take a blood test for estrogen? Usually don't use the gel in the morning, because the gel is a bit like fairy dust. It can get everywhere throughout the arms and on the fingers, and then you can get a falsely high test. So sometimes don't use it in the morning, but speak to your doctor about the best time of having the blood test, because everyone is different. I had a full hysterectomy 6 years ago, just to have estradiol. Should I be taking anything else? I've got arthritis in both knees. Well, progesterone and testosterone are very anti-inflammatory, as well as estradiol, of course. So a lot of people find benefit to their muscles and joints by having progesterone as well as testosterone, but it's very individualized. I've been on estrogen, progesterone, but I still suffer from tinnitus at night and slight dizziness. Would testosterone help? Yes, it can often help actually, but also the right level of hormones. But I don't want you to think that everything is due to hormones. You know, I'm a general physician as well, so if I see someone with tinnitus, for example, I will look to make sure there isn't another underlying cause. So not everything is due to hormones, but a lot is, because our hormones get everywhere. I'm on 75 patch and doctor advised 200 orally. So some people are knee-jerkingly increasing the progesterone if the estradiol is increased. As I've said before, sometimes we give a higher dose of estradiol to get it penetrating through the skin adequately. So we don't need to necessarily increase the progesterone in the same way, because some people who have lower doses of estrogen actually absorb more than some on higher doses. The dose of progesterone is often individualized to the person. And if we give 200, that's an off-license dose as well. So we need to be sure that we're doing it with the right evidence. And there isn't any evidence that those people on 75 or 100 or higher always need to have a higher dose of progesterone. There are some guidelines that say we do, but they're not basing it on any good evidence at all. Endocrine have stopped my testosterone. They say women should never take it. Gynecology said I should follow their advice, and my poor GP dare not prescribe it. Well, we just need to remind people it's a natural hormone. When people are given natural testosterone, then they don't usually get side effects. You know, I've been taking testosterone for about 9 years, and I don't shave in the morning. I don't have a deep voice. I just use the amount that's best for me. So how long would you say does it take to notice a difference when taking testosterone? It can take sometimes 3 to 6 months. It can take longer with testosterone than the other hormones, partly because the dose is very small. Why do I bleed on and off on estradiol and progesterone? Sometimes it can be related to the absorption, but if you're perimenopausal, your own hormones are fluctuating, and so that can cause some bleeding as well. You know, people have bleeding for other reasons as well. People can have bleeding because of polyps, because of fibroids, just because of being on hormones, but it doesn't mean that bleeding is associated with anything awful. And it, you know, like I say, people who are on HRT, if they have it continuous, the risk of having anything nasty like a cancer is incredibly low. So most people who bleed is not due to an alarming cause. But of course, we always ask people to be investigated and make sure there's no other reason, often by having an ultrasound scan. I have severe scoliosis, been on HRT for 13 years. Would testosterone help my spine? It can do. We know that testosterone receptors are throughout the bones and the muscles and the ligaments and the joints. Anything that's going to help protect our bones, reduce our risk of osteoporosis, keep us strong, in my mind is very good, as long as it's not shown to be detrimental. And testosterone is just a natural hormone to try. If it doesn't suit you or doesn't help for you, of course, then you just stop taking it. Neurodivergent here, is it recommended to look at GABA, etc. too, as it all works together? Yes, of course. So GABA is stimulated by progesterone. Some people find having oral progesterone will increase GABA better. All these hormones, these neurotransmitters work together. We can't always measure levels, and we have to remember that levels of hormones in our blood are not the same as in our brain. And so that's why often clinically we work very closely with patients to optimize their dose. So lots of information there. I hope it's been helpful. All I want to really do in my work is try and educate you so you can make choices that are right for you based on science and biology and just basic information about hormones. So enjoy the rest of your evening, and look forward to next week when I'm going to be talking about skin and hormones with Raj Sajpar. So thank you.